In this lecture, we will review topics related to the organization of the radiology department. By the end of this short video, you will be able to answer: what is a radiology department? What is a modality? Who works in this department? What is a radiologic technologist? What is a radiographer? What is a radiologist? And what is the chain of command? Radiology is the branch of medicine that uses imaging techniques to aid in the diagnosis of disease and conditions. Some areas in radiology also treat disease or conditions. Radiology has some confusing terminology. This includes the name of the department itself, which can go by many names including diagnostic radiology, medical imaging, diagnostic imaging, X-ray department, and imaging services. The radiology or medical imaging department can be located in a hospital, outpatient facility, physician's office, urgent care center, or be by itself in an imaging center. In your clinical rotations, you will have an opportunity to visit and work in multiple imaging departments in many of these settings. Imaging departments often have multiple modalities or specialties. A modality is basically a subdepartment within the radiology department, and all of these areas require specialized training. We will review these briefly, but know that later in the semester you will learn more about imaging modalities. The first of many modalities that we will look at is computed tomography. It's often called CT or CAT scan. Next we have diagnostic X-ray, also called radiography. Here is magnetic resonance imaging, or MRI. It uses a powerful magnet, and because of that it can be a safety concern. Do not enter the MRI area without proper screening or permission. This is ultrasound, or sonography. Soon you will learn that this department does more than just scan babies. Next is nuclear medicine, or nuke med for short. Many outpatient centers do not have a nuclear medicine department. Here we have mammography, which is X-ray of the breast tissue. This is DEXA, which stands for dual energy X-ray absorption. This test looks at bone density measurements. Here we have radiation therapy, sometimes called radiation oncology. This department treats cancer using high doses of radiation exposure. PET-CT is an upcoming hybrid modality because it combines two modalities. PET stands for positron emission tomography, and we already know that CT stands for computed tomography, and PET-CT combines both of these to image patients and track their cancer. And lastly, we have interventional radiology, also known as special procedures, or specials for short, and it's also sometimes called angiography. This modality images and treats disease and conditions. All of the healthcare professionals that you saw in the previous slides are radiologic technologists. They are the medical personnel who perform diagnostic imaging examinations and administer radiation therapy treatments. Each technologist has to undergo rigorous instruction within the classroom and in the clinical setting to gain understanding in areas such as education and anatomy, patient positioning, examination techniques, equipment protocols, radiation and patient safety, radiation protection, and basic patient care. They are also responsible for accurately positioning patients and ensuring that a quality diagnostic image is produced. After their education, they take a national certification examination to become certified and registered in their field of study. A radiographer is a type of radiologic technologist. This is the medical professional specializing in performing diagnostic X-ray procedures. If you weren't aware, this is the medical professional you are studying to become. You may hear the term technician utilized to describe someone that takes X-rays. However, this is not the proper terminology. Many technologists are offended when called a technician because we do more than work with equipment. We take care of people and we are highly trained professionals in our field. So please refrain from calling a technologist a technician. Another person that works in the radiology department is called the radiologist. A radiologist is a medical doctor trained to interpret or read medical images for injury and disease in all body systems. Radiologists can further specialize in fields such as neuroradiology, angiography, cardiovascular interventional radiology, and there are many others. Just like technologists, radiologists work in many different environments. Some radiologists only read images and spend most of their time at their computer screens, while many perform fluoroscopic procedures and others specialize in performing interventional procedures. When working in a team, it's important to collaborate and function as a unit. In order to accomplish that effectively, technologists and other personnel working in the radiology department must have an understanding of the departmental operations and procedures. Part of this understanding is knowing the chain of command. This is the official hierarchy of authority within the department. When you need to contact someone, whether it is to ask a question about a procedure or you have a complaint, you must follow the chain of command. That means you reach out to your direct supervisor first. He or she may direct you to address this with the next in line or more appropriate person. Or at times the issue may not have been addressed properly, and then you need to move up the line. Just make sure that you are giving your direct supervisor a chance to address the issue before you move to the next person in the chain of command. Radiology department organization can vary from department to department. It depends on the modalities within the department, the number of lead technologists that oversee the subdepartments, and at times there are supervisors that oversee the lead technologist. Overseeing the entire department is the administrative director. This individual is responsible for the operations and budget of the department. He or she oversees the supervisors and the lead technologists that oversee the staff technologists. Understanding your department organization will help you to understand your chain of command. While in your clinical rotations, you also have a chain of command. Your first line of authority is your supervising technologist or assistant clinical instructor. Next is your adjunct clinical faculty, or ACF. Following that is your director of clinical education, or DCE. And then you see your program director, or PD, and then depending on the situation, you have your department chair, or dean. This is a chain of command that you would use when you have issues within the clinical setting. The radiology department is a complex department because of the many sub-departments or modalities and the many different types of personnel working within the department. Make sure to have an understanding of who works in the radiology department. Also make sure that you are able to identify the modalities that could be located within the radiology department. Remember that not all departments offer all of these modality services. Additionally, you should be able to define chain of command and be familiar with a basic department organizational chart. I hope you found this video helpful. Good luck in your clinical rotations and navigating the radiology department in the very near future.